Well, we are going to wrap up our coverage from Columbus because right now in Warren, the Trumbull County Commissioners are meeting and they are going to address the situation as well. So we're going to switch from Columbus right now to Warren. These are the Trumbull County Commissioners. We'll take that.
January 23rd of this year, the ODH Director Acton ordered COVID-19 as a Class A reportable disease, which meant that any confirmed cases would be immediately reported to local health districts. At that time, the Trumbull County Combined Health District and the Warren City Health District entered into situational awareness operations. And that was so we could closely monitor any potential cases in our county. We also set up public information, and we started to meet with stakeholders to give out the most updated information as it was evolving. In March, we were made aware of a suspect case of COVID-19. Our nursing staff was in close communication with Mercy Health to provide for testing of the individual. Yesterday, we were notified of a positive result of COVID-19 in our county. It was a 55-year-old male, and we immediately, at that point, opened all emergency operations to respond to the situation, and also to deal with the inundation of inquiries that we were receiving. So we immediately reached out to contacts to determine the need for any isolation or quarantine measures. At this time, I will say our county is recommending all social distancing measures that are being prescribed by the governor's office, and I know there was a number of them just asked, and we will be supplying that as it becomes available. And I will go over that shortly. And we will be posting that information as it becomes available to us. So at this point, I'd like Sandy, our nursing director, Sandy Swan, to talk about the nursing response of identifying close contacts.
So yesterday, when we received the notification that our suspect case was indeed positive, we have policies and procedures in place that we follow for contact tracing of an individual who has any communicable disease. So we implemented those policies and procedures. To date, we have 27 contacts that are either isolated or quarantined, and some are just being monitored. What I'd like to say is, as more contacts become to our attention, we will follow up on those contacts. If the public has not heard from us, then there is no reason for them to be concerned about being a contact to this individual. I also want to mention that we need to continue to practice preventative measures because we're still in the middle of flu season, allergy season's going to start. So we want people to be very cognizant of following good respiratory, flu, and cold hygiene measures. Cover your mouth and nose when you cough or sneeze. Wash your hands often. They recommend 20 seconds or more. If soap and water is not available, utilize hand sanitizer if it's available. Cough or sneeze into your sleeve if possible. Keep your hands away from your face, and if you're ill, stay home. And also, just remember that we are following our policies and procedures, and we will continue to assess the situation and continue to contact those that we feel might have been exposed to this individual.
At this time, I'd like to introduce Dr. James Kravick. He's the Chief Clinical Officer of Mercy Health of Youngstown.
Good afternoon. My name is Dr. Jim Kravick. I'm the Chief Clinical Officer for Mercy Health Youngstown, which covers the Columbiana, Mahoning, and Trumbull counties, and really been working with the local health departments, both Warren, Youngstown, Mahoning, and Trumbull and Columbiana counties over the past several weeks I was asked specifically to talk through some of the preparedness that Mercy Health has been doing in regards to COVID-19, the novel coronavirus. And really, this started in the very beginning, as the Health Commissioner talked about. We've been prepared for quite some time, going through preparedness steps, educating physicians, staff, calls not only locally with Mercy Health, but also from our system, from the entire Mercy Health system across our 7 states where we serve our patients. And so I think the biggest thing we've done is the education of our staff. And we've had several patients that we've been continuing to monitor for COVID-19, and as Health Commissioner mentioned, we did have a positive case. I will defer all details of that case to the Health Department, as they already mentioned earlier. As far as the preparation, many have seen some comments in the news about a tent on the campus of St. Elizabeth Youngstown, and that has been placed last night and is finished in process today. That is truly in regards of preparation for patients that may continue to come to see us in our emergency departments. So nothing has changed other than it's part of our emergency plan that has been in place since the very beginning, and we implemented that yesterday just in preparation. You may continue to see things throughout the Mercy Health facilities, at our hospitals and at our ambulatory sites and our primary care physician practices. And this is in preparation, and this is all planned. Nothing is reactionary. This was planned yesterday to have the tent up. As we continue to have more and more patients see our emergency room physicians and staff, there may be a need to have overflow for screening in those areas. And so this was truly meant as a preparation phase and not something reactionary to the case yesterday. This is something that was planned as we've gone through our last 6 or 7 weeks of preparation. Mercy Health has 20 to 25 different areas where we do walk-in and primary care. And we are standing up 2 new sites in the next several days for walk-in care, specifically for patients that may be concerned with respiratory illnesses, with flu, with strep, maybe concerns of COVID. And as we have those plans, I don't have specifics right now, but we're looking at 1 in Trumbull County and 1 in Mahoning County right now. There may be more. I will come back to you with more specifics as I have them. The team is literally meeting as we meet, working through who's going to staff that and hours and the specific locations. So more to come on the specific locations of where these walk-in care. We know that the community is asking for that. We know that the primary care physicians are getting many, many calls. The Mercy Health primary care practices are getting many calls, and that's okay. We don't want people, if you're well, we want you to stay home. If you have concerns, call your primary care practice. Dr. Acton recently spoke in the last hour. She is the medical director, or she's the director, of the Ohio Department of Health, and her comments were pretty much stay home if you're not sick. Don't get tested. Don't try to get tested just because you want to know. Yeah, it really should go by clinical symptoms, and to make sure that we do the limiting of social gatherings and limiting of connectivity to reduce the spread. So again, as we prepare, as we go through this, from a Mercy Health standpoint, we are prepared for this. The hospitals are prepared as far as taking care of personal protective equipment for our physicians, nurses, staff, and the other patients. We're prepared as far as the primary care sites in the practices. And we have taken other precautions, such as reducing some visitation. I know many of the local hospitals are reducing visitation. I think that's the responsible thing to do is limit visitation. On mercy.com, there's a special link for coronavirus, which lists our visiting limitations and other changes. We've reduced the number of entrances that people can come and go from the hospitals. The emergency department and the main entrance of each hospital of St. Joseph, Warren, St. Elizabeth Youngstown, and St. Elizabeth Boardman is really the only places we want people coming in the hospitals, to limit people that may have fevers, cough, other illnesses from coming in to visit. Nursing homes are continuing to limit visitors, and this will continue to increase. I know the 2 Mercy Health nursing homes have done visiting restrictions to help protect the residents of the facilities, people that live there. So those are some of the main things that we're doing to be prepared for more cases of COVID-19, as well as the flu and now that the common cold that we know is out there. And so I think that's my message today, is that, you know, there is concern. We're getting prepared, but there's not panic. Everything we're doing is planned as far as the approach, and we're very blessed to be working with the Ohio Department of Health and the local health departments, who are very qualified to take care of this as well. Thank you.
At this time, there are a number of elected officials that will come forward and give updates from their perspective, starting with the county commissioners. You can introduce each one moving forward.
First of all, we want to thank Frank for the great job that he's doing. Every Tuesday, oh, you got there, yeah, might as well. First of all, we want to thank Frank Migliozzi and the great job that he's doing. He's been informing us on the updates of everything that's happening from the state level, federal level, so that we can inform our workers. We're concerned about our workers. We're concerned about the citizens who come to our buildings every day. I walked through a couple of the buildings this morning, and I did notice that they're doing exactly what Frank said. They have all the supplies necessary to keep cleaning the various doorknobs, and telling people to keep their hands clean, wash their hands constantly. They have all of the supplies that they need necessary, or that are necessary to do that. Also want to thank everybody for coming here today. We want you to keep your workers informed over the information that Frank's giving us. Thank you, Frank.
Yeah, thanks everyone for coming here today. I think the old adage, an ounce of prevention is worth a pound of cure, and I think that's what we are doing with Dr. Kravick and our health director, Commissioner Mr. Migliozzi. We're going to be meeting weekly after our work session. We're certainly concerned about our employees, our citizens, so I think a lot of the washing your hands instead of shaking hands, maybe elbow bump or whatever, but I think just taking precaution to so that this doesn't spread, and best thing I recommend you do is pray for our city, our county, and our country for a speedy recovery, hopefully an antidote that can fight this. And it's something I've ever seen like this since my lifetime. So it's scary to a lot of people. A lot of people are really, there's panicking going on out there, and we just want to keep people calm and let them know that we're doing the best we can with our team that we have in place. So thank you.
Just to echo some of those sentiments, the role of government, first and foremost, is to ensure the safety and security of its citizens, and Trumbull County remains committed to doing just that at all costs. The recent developments with COVID-19 have us all kind of stirring and in a panic. This is sort of uncharted waters, but we urge individuals and businesses to remain vigilant about, the guidelines that the governor has brought forth, and that the guidelines that our health department brings forth. The county has begun a more thorough and comprehensive cleaning of all of our facilities daily. I saw Al here. Al DiVincenzi is here. The commissioners have authorized additional funding for cleaning crews. In addition to normal cleaning schedules, all high-touch surfaces, doorknobs, elevators, conference tables will be wiped down with extra attention with industrial-grade cleaner. All, as you know, what the governor said today, all large non-essential gatherings at all of our county facilities will be postponed and suspended indefinitely. Also, all out-of-county travel, related to seminars or to continuing education or anything that anybody has to go to Columbus or DC for has been postponed and suspended indefinitely. We're asking all of our department heads today, and we've communicated through email, to identify any work that can be done remotely by any individual, in other words, from home, so that we don't congest the building any more than we necessarily have to. And lastly, as my colleagues mentioned, it's up to each of us to be vigilant and to be very self-aware so that we can mitigate the virus. We wash our hands. We have sound hygiene practices that Mr. Migliozzi will talk about, because at the end of the day, each of us share a moral and social responsibility in trying to mitigate the virus. So thank you, and I'll turn it over to Frank.
Actually, we have a number of state representatives.
I'm sorry.
We're state representatives and our state senator and a few mayors. So I would just say, instead of me keep introducing, if one can just come up and then the next.
Let's start with Sean O'Brien.
Again, thank you all for being here. Thank Frank and his department. I had meetings with them this morning. I know they've been working very hard on this issue. And again, it just goes back to what's been said. Use common sense, wash your hands, don't touch your face, follow the guidelines that the governor has laid out. It's going to be difficult for the next couple of weeks. I know a lot of parents are concerned because the governor has requested a shutdown for 3 weeks for schools. So that's going to produce a lot of hardships. We understand that, and we're trying to help as much as we can. I've been in contact with the governor's office. I was on a call this morning with the Department of Health and the governor's office. Frank had a couple of questions we were looking into to try and help out. But again, to be calm and work with and follow the directions of the health department is going to help abate and assuage this situation. So appreciate that. Thank you.
As Senator Bryan mentioned, we've also been in contact with the governor's office, and also I've been in contact with the Director of Education Service Center regarding the schools and how it affects each school division in Trumbull County. The 22 school districts in Trumbull County, and all have unique issues, and those superintendents and Mr. Henshaw assured me those superintendents will figure out their own particular needs regarding the students. You know, for instance, in his example, Orange City Schools provides breakfast at school and lunch at school, and they'll try to make some kind of accommodations how that'll work out with those students. I see John Gargano here, and I want to reemphasize that the clients of Job and Family Services, if they can call regarding, rather than visit personally, call, or if they have access to computer through email, in regards to the particular cases of Job and Family Services, would again cut down in the contact visits. Basically, the steps that are going to be taken in the next few weeks, whether it be in Trumbull County, the state of Ohio, this country, are basically, the steps are going to be saving lives. So the preventative measures you take today will save lives in the future, and that's what's so vitally important. So by everyone in the same direction, starting from the governor's office down to the township trustees in Ohio, if everyone takes the necessary steps and follows directions from the health professionals, the ultimate is to save lives.
Bill?
I want to build on what my fellow representatives have said, and I wanted to mention that Director Migliozzi and I had a talk about 2 weeks ago, and in that talk the coronavirus came up, and he outlined for me the broad framework of the County Health Department's plan to respond if we had an outbreak. And at that time we were certainly hopeful that it wouldn't occur, but I'm very confident that the plan was in place, is in place. And I want to commend Frank and all of the medical staff, because The one thing we have to recognize is Trumbull County is not only one of the first communities in the state of Ohio that's addressing this issue, but we're really one of the first in the entire United States addressing this particular virus. I was on a conference call yesterday with the White House. The federal government has put $8.3 billion behind a bill to combat this virus and supports local and state governments in handling the virus. And the one thing I would reiterate, everybody in Trumbull County and around the state needs to take the time to educate themselves on this virus, how it is spread. They're continuing to learn about it every day, and take those precautions that you need to take to protect those at risk in our community, our elderly, our children that have some underlying health conditions, and really everybody you come across, because it's those precautions that will help to alleviate the spread of this, and that's been stressed at every level, including the governor's press conference today. So I want to thank everybody, and as always, our offices will be of assistance whenever needed.
Mayor, would you like to say something? Mayor Franklin?
We also have the mayor.
Yeah, Mayor Cowles.
Good afternoon, everyone. First and foremost, I'd like to thank Frank for his leadership. Also, I have to commend Governor DeWine, who from the start was very proactive, very assertive, and for his leadership and guidance. The city is taking our protocol from the healthcare professionals, just as the county is, and we're monitoring every day what those directives are. With us, I do have Bob Pentai here, who had surgery yesterday, and also the head of our nursing division, Cheryl Strother, and safety director, Eddie Colbert. And Mr. Colbert has directed all of our department heads to take the necessary precautions and install or institute the proper protocols as prescribed. I'd like to thank personally Dr. Kravick. I didn't know who you were, but I know we were on the phone. I was at Mayor Brown's office, and we did about a 45-minute press conference with the Youngstown Health Department as well. So we're busy exchanging notes with every single agency that can help us. I want to echo the remarks of my colleagues. This is no time to panic, but it's time to use common sense and to make sure that we institute those practices that have been prescribed. One side note, I know we have shut down, or not shut down, excuse me. We're still accepting water bill payments, but we've changed the way that we're taking those payments. We're not doing any drive-throughs, and we're limiting all direct contact with all of our employees. We're asking all visitors to City Hall or any of our public buildings, court, to make sure that they're very essential visits and no extra people or family members to add to those visitations. Another encouraging note is of what I see around the community, particularly with Warren Family Mission, who gives out over 400 meals per day. We've talked with them earlier today, they've instituted new changes in how they're going to distribute food, so they'll still be providing the services, but they'll all be take home. They'll be in to-go package, so we're going to have more on that tomorrow. And they do 1,000 for the Easter weekend, so 2,000 to 3,000. So that's very important that they're already instituting those. So we're just focused on working with all of our partners. We're all in this together, but if we just stay together and stay the course, I know we'll get through this. So I'd like to thank our state representatives as well for their leadership in this as well. Thanks a lot, and we'll get through this.
Thank you. Ben, would you like to say something? Ben Cowles, Mayor of Hubbard.
On behalf of the City of Hubbard, I'd like to thank our state representatives, our county commissioners, and Frank and your team for keeping us in the loop from the beginning. Our residents and our workers and their families are of our utmost safety is our concern. And we've taken the steps from the beginning to make sure that everyone has everything that they need within the City of Hubbard. Our safety services, and most importantly for myself, I have a senior center, and we are in constant contact to make sure that our seniors that do receive services through our senior center are going to be taken care of no matter if the senior center needs to be shut down. We've already been in contact with the Office of Elderly Affairs to make sure anyone that would be receiving home delivered meals or that came into our senior center, we would personally deliver the meals to them.
So we just want to make sure that all of our residents know that we're doing everything we can along with Frank and his team. Thank you, and I appreciate from all of us, all of your support. Thank you.
Thank you, Ben. Sheriff, did you want to say something? Sheriff Paul Monroe.
First of all, one thing I would like to say is that, you know, our public needs to remain calm. There's one incident, but I strongly encourage our public to maintain social distancing. Any non-essential visits that you need to make to any of our public buildings, we've put an end to some of that. We stopped all prisoner visitations today for the next 21 days. We've ceased CCW registration for the next 2 weeks. And I strongly encourage our public, if it's not an essential trip, stay home. You're looking for what you can do to help us, stay home, stay out of the public. If you don't need to come to our buildings, please don't. If it's an emergency, call. The sheriff's office will respond to your needs immediately. Thank you.
Thank you, Paul. Thank you, Sheriff. Is there anyone else that have a comment? Want to comment? Judge?
Thank you. Just in regards to the family court, our court is a little bit different than the rest of the courts situated around the county because we also have a detention center. We've been consulting with the Department of Health and the Sheriff's Department, and we are going to start suspending visitation as well. We will be getting letters out and notifications out to the families. We're going to increase the ability for our residents to make phone calls to their family, and that is right now something that we are developing. We're also going to try to limit the amount of people that come into the building and try to work on some sort of screening procedure for the people that are necessary to enter the building. And we're also going to try to do most, if not all, of our pre-trials via telephone, so I would advise anyone who is coming to court to contact their lawyer to see about the ability to avoid having to come to court and do the pre-trials by teleconference. So that's right now, there's planning going on right as I speak on those things. So that's about all I have, but I would just tell people to stay in contact with their lawyers as far as the family court goes, and we have juvenile and domestic relations there. So that's all I have. Thank you.
Thank you, Judge. We have other elected officials. Karen, Todd? Thank you. Todd Littell, Karen Ellen, and Sam Lambacusa. Sam, did you want to comment anything? I did stop at the Board of Elections today. They've assured me that they're taking every precaution to protect the voters. Also during next Tuesday's election, they have a plan in place. They have a supply of everything they need to make sure everything's cleaned after each person votes. So, same with Job and Family Services. I had time to go there this morning, spent a couple of hours with them. They're working diligently to keep their facilities in the safe position for keeping the people healthy. I'll be attending the other buildings over the next couple of days. Yes?
Is there a representative from Stewart Health here today?
From where?
Stewart Health for Trumbull Memorial?
No, there isn't.
Were they invited, or?
Actually, I don't know.
No, we brought the healthcare system where the case occurred.
Okay.
Bob Pintai from the Health Department's here, from Warren Health Department. Bob, did you want to make any comment?
Truly, I think the major points have been covered several times, and the only thing I can say is, I know, and you hear these comments in the community at large, you know, something so simple as hand washing and social distancing and staying home when you're sick, but these are the key elements to try and put this thing in check. So even though they seem very simple and very elementary, this is what has to be done to hopefully put this thing in its tracks, stop it in its tracks. So other than that, and I think it's been covered many, many times through some of the speakers, but that is the key element to what we need to do.
And I think Frank did a great job teaching everyone that, because when I went to Job and Family Service, I think every person I talked to told me that they had to wash their hands and they went through the whole spill, Frank. So, and Frank will be meeting every Tuesday here at our work session and updating us on what's happening.
Renee,
oh, Renee, yes?
Yeah, for the state and senators and representatives, are you guys working on any plans with the governor's announcement today that schools will be canceled for 3 weeks to help people with childcare? Or testing, is testing going to be covered for uninsured people?
Well, as far as the governor's office, and I've had conversations with the governor's office.
Well, we are going to wrap up our coverage of the two news conferences that you've heard this afternoon. The first one with Governor DeWine, the Lieutenant Governor, and the Department of Health in Columbus. And this one you just heard that was taking place in Warren at the Trumbull County Commissioners meeting room. Locally, we heard the situation that was going on there. Just a couple of things we want to highlight before we sign off. They did confirm that there is a 55-year-old man right now in Trumbull County that has the coronavirus. He has a family, he has children, all of whom have been quarantined. Also, over the banning of gatherings of over 100 people. That one came out of Governor Mike DeWine's news conference, so they will be banned until further notice at this point. Those are large gatherings of more than 100 people. Now, that does not include shopping malls, restaurants, or grocery stores, but you may have heard the governor say that if you do go to a restaurant, try not to go to a crowded restaurant, kind of keep them not crowded. And they mentioned the social distancing of trying to keep 6 feet between people. Also, Election Day will go on as scheduled next Tuesday. The polls will be open. Also, one of the big things, as of Monday at 3:30, there will be no school anywhere in Ohio for the next 3 weeks. So there will be no school as of Monday, after the end of school on Monday, for 3 weeks after that. We also just heard that Major League Baseball has canceled the rest of spring training and also the first 2 weeks of the season. One interesting note that came from Dr. Amy Acton, the director of the Ohio Department of Health, is that she thinks this is expected to peak sometime in late April or possibly mid-May. That's what's the modeling showing, though they may not be perfect models. And as she mentioned as well, this may not be perfect as we work our way through what is now pretty much a crisis situation throughout the state of Ohio. We are going to now return you to our regularly scheduled programming. We will, however, be back here at 5 p.m. for First News at 5 p.m. and then First News at 6. I'm Stan Boney, WKBN 27 First News.